Okay, so welcome you all to this webinar. And this is all about the Global Rural Health Summit, which we are going to organize in April next year. And this Global Rural Health Summit will take place on 4th April 2025. And it's one of its kind because it's the first time we are going to organize a summit. So how it's different from a conference? Because this summit is all about specific themes which we'll discuss. And our idea is to publish a full scale paper on our journal. As you know that we hosted our last World Conference in India in 2018, and the declaration was published in WHO website. And following it, we also had COVID, and we did some lots of publication during that. Vaccine inequity was published during this time. And now we have this global rural health, where we will discuss some of the important topics like health workforce dynamics, optimizing health workforce delivery. Climate change is one of the important topic, and global health, which is from our local lens on challenges and solutions, and global perspective on rural health and lessons for LMICs. But before we get into details, since most of you all have joined, there are some people who are still in the waiting room. So we have got some good number of participants. So we'll just begin with a brief, very short round of introduction with you all, and then we'll start the session. So I'll start with myself. I am Dr. Pratyush Kumar, Chair-elect of Rural Wonka and the convener of Global Rural Health Summit. Followed by, yes, you can start, Roshni ma'am. You can start with this.
Hello, everyone. Good evening. And it is indeed a pleasure to be in the meeting today. Pratyush has done a great job, and we are hoping to make the Global Rural Health Summit a big affair, a celebratory affair. And we need all your support in the Wonka, conference, the South Asia Region Conference, to be there with us in Bengaluru. So thank you for having me, Pratyush, and all the very best. Thank you.
Thank you. So Dr. Bruce.
Pratyush, it's great to be here. It's a little bit late here. It's in the middle of the night, 12:30 in the morning. So welcome from Australia, and welcome as the chair of Rural Wonka. And we certainly look forward to seeing you all in India again. It's such an important issue about rural health. In South Asia, but also all around the world, and especially in environments where there's some resource limitations. So I look forward to some terrific presenters, and I look forward to the discussion tonight. Thank you.
Thank you, Bruce, for all the efforts and your leadership. Next is Bikash Gauchan, from Nepal.
Hi, hello everyone. My name is Dr. Bikas Gauchan. I'm from Nepal. I have been working with Rural Wonka since 2016, so I'm very excited to be working in this Global Rural Health Summit. So I look forward to working more, and I look forward to seeing and meeting you all in the next few months in India. Thank you, Pratyush.
Thank you.
Your voice is breaking. I think next is Amber Weekly. Yeah.
Okay.
Good morning, everyone. I'm Dr. Amber Wheatley here from the British Virgin Islands. I am one of the founding members of Rural Seeds and former Young Doctors and Medical Students Portfolio Lead for the Rural Wonka Executive, but still a member of Rural Wonka. Looking forward to the meeting today.
I think we've lost Pratyush. Pratyush, are you there? Can you hear us?
So
Yeah,
Canon 2,
please.
can you please introduce yourself?
Sure. Hello all. I see some familiar faces, and I also see interested in rural health people here. I'm a doctor. I'm a family medicine physician in Turkey. I'm from Bursa. I work as a lecturer in a university. Also, for 2 years, I've been working close to Pratyush online in rural Wonka executive, and I know how he's amazing. He's hardworking, and it's a privilege here to work with all of you. Thank you.
Next is Govit.
Hi everyone, this is Gobi Ratnasingham from Sri Lanka. As you may, most of the familiar faces are here. I'm also one of the family physician, mainly working in the rural area, also the academic. And I'm part of the Wonka Rural since 2018, currently in the executive with the portfolio for low middle income country. Actually, I'm very happy to be here like the Global Health Summit and we are discussion. Actually, we have a lot of challenges and these disparities in the rural. So we will go into talk in hereafter. Thank you.
And welcoming Anna. Anna Stavda, can you hear me?
Hi, Pratyush, did you call my name?
Yes.
You did, yeah. Okay. Hi, I'm unprepared to say anything. There's some domestic noise behind me, but I'm very happy to see familiar faces and names on the screen. Looking forward to the webinar. Congratulations. And I'm also looking forward to see many of you in India in April, in a few months.
Thank you.
So very good to be here. Thank you very much.
Okay. And next is Vasundhara. Please discuss something regarding pathology also and how you want to integrate it with rural health.
Okay. Thanks, Pratyush. Nice to see some familiar faces here. I am Vasundhara. I wear 3 different hats, I would say. 1 as a primary care physician, 2 as a public health person, and 3 as a lab person, all in different parts of rural India. And I have been telling Pratyush and even Bruce actually that not just because I'm biased towards lab medicine, but we need to focus on lab medicine, diagnostics, and image, which includes imaging, and also in rehab and physiotherapy as important parts of rural health care. Yeah. Thanks a lot.
Thank you. That's why we have invited to publish a full paper on diagnostics. And as we can also tell you that we also have a special interest group on point of care testing, something which might be of interest. We can discuss it later on. Next is our Wonka SAR secretary, Sankha.
Thank you, Pratyush. Hi, everyone. I'm Sankha, a family doctor from Sri Lanka. I joined the Wonka Working Party in Rural Practice in 2016 at Rio, and very happy to be with you and to contribute to the webinar. Thank you.
And next is Omnia from Egypt. Welcome you.
Well, welcome everyone and good evening. This is Dr. Omnia Azat Sharif. I'm a family medicine consultant in Cairo University Hospitals in Egypt. I joined work maybe in the year 2011. The first meeting was in Czech Republic, and then I have been able to participate in several Wonka conferences in Prague, in Brazil, in Rio. And I had the chance of meeting Anna last week in Qatar. During the first family medicine conference over there. I participated with a poster there, and I'm so happy to be among my colleagues whom I've seen a lot of faces before, I think, in WONCA conferences, and of course, my dear friend and colleague, the star, Dr. Roshni. We had several meetings together, and we attended at the University of Toronto, one of the leadership programs in enhancing leadership in family medicine. Thank you all, and so happy to be with you.
Thank you. Next is Nisant Menon.
Hi, happy to be here. Dr. Nishant Menon. I've been associated with FPI Rural WONCA since 2016-17, and really happy because Pratyush had invited me for a rural health plenary session here at my hometown in Kochi, Kerala. And since then, I've been associated with most of the activities which Pratyush has been pioneering in India. Really happy to be part of it.
Thank you. And next is Manish Prabhakar.
Hello everyone, I am Dr. Manish Prabhakar. Basically, I am community health physician, currently working as a senior resident in PGI Chandigarh. And I am associated with WONCA since 2018, the first rural conference which was held in Delhi. Thank you.
I think the rural conference in Delhi was a big opener to connect us many faces which we can see here. We connected during the WONCA WSC 2018, and Manish is also part of the IMA group, which is one of the largest organization in India and also part of World Medical Association. Everything. So next, welcoming Hina Javed from Pakistan. Hina, can you hear us?
Hi. Thank you for the invite on this group. And I think I've nominated a few people and still a couple are pending. But thank you for approaching me. And I really appreciate your input regarding promoting rural health in South Asia. Thank you.
And thank you for helping us to connect with lots of great minds from Pakistan. And this is, I feel the Global Rural Health Summit is one of the biggest opportunity to just recognize the rural health professionals who are working on ground, but are not getting that much of recognition. That's the whole aim of this thing. And next, inviting Ping Fu. Ping Fu, can you hear us?
Hello, I'm so sorry. Hello, can you hear me?
Yes.
Thank you, Pratyush. I didn't expect I need to introduce myself. Hi, everyone. I'm Ping Fu from Malaysia, so representing the Academy of Family Physicians of Malaysia. So basically, I think my president, the current president of Dr. Yanti, I think she did, told her interest to Dr. Roshni that she will be coming to India next year. So I'm also bringing some new faces, new blood, I think, in rural health, which I think she's here, Dr. Sharina Tamri. I think she's from, because in rural in Malaysia, we have the Borneo side. So basically, it's a very, how to say, it's a very important aspect in Malaysia, the rural health. Not only on Borneo part, but we do have the Aborigines, in Malaysia, which is what we call Orang Asal. So, we have few Aborigines in Malaysia. So I think, yes, just happy to be here to reconnect with everyone here. Thank you.
Thank you. Next is Zakur Rahman from Bangladesh. Zakur, can you hear us? No. Okay. So I'll invite Myra Alexandra from Colombia.
Hello, everyone. My name is Alejandra Leon. I'm from Colombia, and I'm a member of the rural group of the Ibero-American Confederation of Family Medicine. Actually, I have community project in a rural area, and we work about mainly in mental health and in females, and also with new masculinities. And really, I'm delighted to share this space with you. Thank you.
Thank you. Thank you. And next is Harini Iyer. Harini, can you hear us?
Yeah, sorry, just a moment. It is super early in the morning. Sorry about that. Hi everyone. My name is Harini. I'm based out of Saskatoon in Canada. My hometown is Bengaluru. I was recently
Canada, Colombia joined.
Oh, sorry. So I was recently at the Towards Unity for Health conference in Cape Town, where I met Pratyush and Bruce, and they told me about the Rural Wonka group. So I'm really interested in participating this year. It'll be my first, and I have a PhD in community and population health sciences, and I specialize in social accountability in health systems. So thank you. I look forward to this year.
Thank you. And next is Kille Bhuti. Can we hear from you? Thank you.
Hello, hi, good evening, good morning, and good afternoon. My name is Kilebuti. I am a GP consultant in Bhutan, and I'm also currently serving as the White Young Doctors Movement Spice Route Chair for South Asia. And I also got involved in Wonka from Delhi, the memorable Delhi's Rural Conference 2018. I'm very excited to see many new faces and all the old friends as well. Thank you all for inviting me in this group.
Thank you.
I'm looking forward to learn more.
Thank you. And next is Ezaz Khan.
Yeah, thank you, Pratyush. I'm grateful to Dr. Hina Javed, who introduced me to this forum, this August forum. I'm professor of public health, and I'm also a primary care physician. And my specialization is specifically in the climate change and environmental health. And I also have this primary healthcare management specialization. So nice to be here. And I look forward to publishing a very good piece of work along with you people. Thank you.
Thank you. Thank you. Leonardo, can you hear us?
Yeah, am I audible?
Yes, yes.
Okay, thank you very much. Hello, everyone. My name is Leonardo. I'm a psychiatrist by profession, but I have been engaged with Wonka since around 2020, I guess, especially during the COVID-19. I have a big interest in particular for the global mental health. So that's why I'm very keen to learn, and also if that's possible to participate in this event. The coming event on 2025. So thank you very much for having me as well. Yeah, thank you.
Thank you. Next is Dora Bernal. Can you hear us? Dora, can you hear us?
Hi, Patrish.
Hello.
Do you hear me? Hello.
Yes, yes, yes.
Thank you. Thank you. Hi, everyone. I'm Dora Bernal. I'm the president of the Iberoamericana Confederation of Family Physicians. We are very interested in participating in the summit. We are trying to organize a group to go because we are very far from India, but we are trying to arrange everything to work to take part in the organization or in the conferences. Great to see you and great to be there. Thank you.
Thank you. Next is Marjorie. Marjorie Cross.
I'm in Australia and 1:30 a.m. in the morning, and I look forward to being very. And there's a lot of background noise somewhere. My name is Dr. Marjorie Cross. I'm in Australia, been involved with this for a very long time. I look forward to this being a much more inclusive organisation. So it's 1:30 in the morning here, so I'm not going to turn on my video and look forward to listening tonight.
Thank you. And thanks for all the support all these years. I have seen you are very supportive all these years to all the Rural Wonka activities. And thanks for all the work you do. And next is Tariq. Can you hear us? Tariq? Next is Pavitra Mohan. And Dr. Pavitra, can you hear us?
Yeah.
Yeah, I can hear you, Pratyush. Thank you. My name is Pavitra Mohan. I a co-founder of an organization called Basic Healthcare Services that works in rural Rajasthan in India, that aims to provide high quality, low cost primary healthcare to the rural remote populations in Rajasthan. We co-hosted an India-specific consultation during the last World Rural Health Conference in Delhi. The idea was that there is so much out there. There's so many learnings from different countries, both the LMICs as well as countries that have more advanced levels of healthcare. And we wanted to sieve out those lessons. And there's often said that India is not one country; there are multiple states. Each of them have so much to learn from. And the idea was to sieve out all those lessons from both within India and from across the world, to see what can how do you take some of those learnings forward. And I'm glad that as an outcome of that consultation, several policy recommendations that came provided a path, and some of them were subsequently adopted at a policy level over last 5-6 years. So we are very excited to to have the conference again in India, this time the World Rural Health Summit, and we are hoping, discussing with Pratyush about having an India specific consultation during this period to again learn from various countries out there, as well as from some of the models from within India. And yeah, somebody said that you're very far from India, but I think all of you are very close to hearts of India. So we're very happy to kind of see you here, or even if you're not able to participate, yeah.
Yeah. So from here, we are going to discuss something what we are going to do in this Global Rural Health Summit in detail. And one is to have India-specific consultation meet, because it's very important. Not only the Indian rural health professionals will join, but also international leaders will be joining the summit. And Dr. Pavitra Mohan will be hosting this, and it will be 2 to 3 hour session. My question is like, what the young family doctors or young health professionals who are willing to work in rural areas can expect from this summit and this consultation meet? Why they should attend this summit from Dr. Pavitra?
Yeah. No, I think, and I'm also, I was just seeing Hina also in the group here, and she sent a message. And we had a small kind of a seminar with on the leadership in primary healthcare. And I think one of the important ways forward, with so many crises that are affecting the world, and India is an epitome of that. There are, on one hand, there are most advanced levels of healthcare, and on the other, there is, absolute misery. There is even for a patient of tuberculosis, it may take months before the person is put on treatment. On the other hand, you can get in the most advanced treatment. There are such inequities. There are challenges of globalization, and even in the areas that we work in, the climate change is really affecting people on a day-to-day basis. There is worsening income poverty. There is worsening malnutrition levels, and temperatures are affecting. So all of them require much more than going beyond your individual discipline to address some of these challenges, especially in the most difficult areas that many of us work in or work for. And therefore, I think we need to have a greater kind of understanding of what different solutions lie in different parts of the country, of the world, and what those solutions could be taken in, work together, collaborate, and assume leadership positions. So I think for the young doctors, I would think that learning from all this and seeing that how can they prospectively build themselves as leaders in the area of primary healthcare, in the area of rural healthcare, to address some of these absolutely pressing challenges that we all need to. So while somebody said that it's a time for celebrating celebrations, it's also time for deep reflection and action to move ahead. And that's where I think the younger professionals, many of us are gray-haired like me here, but there are also many young like Pratyush. So I think the challenge there is to say that how more and more younger family medicine professionals, the rural healthcare professionals, and other multidisciplinary people who are coming together here in the conference and in the summit to take on those leadership positions progressively. So I think the summit is a good time to get to both witness what's happening around the world, and to get inspired, and to also contribute in shaping a more equitable and empathetic world.
So thank you. So in rural Wonka also we have got rural seats, and now we have Veronica and Amber also joining this webinar. So I'll ask them to talk regarding rural seats and what they see for the young doctors and medical students role in this rural health summit, and just as a whole, what do they see? Veronica, can you introduce yourself, and followed by Amber?
Hi everyone, great to see you all. So I'm Veronica. I'm one of the founding Rural Seeds ambassadors, and I'm also a member of the Council of Rural Wonka, and here representing Eureka and a bit of a European perspective on rural as well. I'm currently based in Wales. And regarding kind of Rural Seeds and what we could contribute, I guess it's really about looking at maybe different perspectives generationally and what people are hoping and expecting from their rural careers, and maybe thinking about that aspect of things as well at the summit. But as was mentioned before, having that opportunity to speak with more experienced colleagues, to hear about different career journeys, and I think see how they could develop a career in that kind of rural health space for themselves. And as was mentioned, looking at those cross-collaborative areas where, you know, where does rural health intersect with climate change? Where does it intersect with social determinants of health and public health? And how do we start breaking down some of those silos and working more collaboratively with other sectors and other colleagues? So yeah, those are my first thoughts. Thank you, Pratyush.
Thank you. Amber, can you please introduce yourself? And Amber, can you hear us?
Amber already discussed.
Okay, so we'll
You're on mute, Pratyush.
okay, thank you. So Amber, can you hear us? Amber? No. So here we are going to
Yes, I
start
can hear you.
discussing.
Sorry.
Yeah, please.
Sorry, can you repeat what the question was?
Yeah, we are discussing regarding the role of medical students and young family doctors in the rural field. What do you see their role in overall regarding the health workforce, or regarding the health services, or the climate change, everything?
Okay. So what I see their role is two main things. So the first thing is obviously they are the future of our health force, our workforce. We obviously need to make sure that our profession, but the other role that they have is with innovation. So what I found with Rural Seeds is a lot of the projects that we have, yes, they come about because of student and young doctors' needs. So for the training, support, that sort of thing. But sometimes it's also their ideas and their own desires for the future that inspire a lot of our projects and help point us in the direction that we need to go. So those are the two main things that I think.
Thank you. So there are a few more new members who have joined, and but we'll start the discussion regarding the sub themes, because we also see the timings. So here we have got 5 sub themes. I'll just brief you all. First is regarding the health workforce and the health workforce dynamics. Here we are going to discuss something in detail, from medical education to becoming the consultant, and the whole circle of journey, how they start choosing the field, whether they want to practice in rural areas or whether they want to go to urban areas. And discussing those topics, we have got multiple authors on the board. Canon Tools is there from Turkey, Alexandra is from Canada, Angelus is from United Kingdom, Professor Mary is from Pakistan, Harinia is from Canada, and Mercy is from Kenya. The idea of this summit is to have a diverse viewpoint. So we have got in this, if we'll check our sub themes, we have got multiple authors from different countries who will bring different different thought processes, different experiences on the board, and we will finalize all the details and we'll publish a paper. So I'll invite but before we begin, I'll invite Bruce to have just opening remark regarding the summit, and then we'll just go on to the authors for their opening remarks.
Babitra, I think workforce is obviously particularly important, and I think we do have a really good theoretical and evidence base now for recruitment to workforce. I think the factors are known. The issues are really how are they individualized for particular countries, and also how can we make sure that we have the total pathway. So it has to be, everything from storybooks to 5-year-olds right through to retention of doctors in rural areas. So I think it's going to be important to cover that whole gamut, but also look at how we can apply it in particularly in the context of all the people that are here tonight. Thanks, Pratyush.
Thank you. And next is Canon Tools, your opening remarks on this.
Yes, actually, I was not very familiar with this topic, but Wonka Rural President Bruce Chater had a very good remark on me, and I'm so inspired from him. One day I mailed to him, and he was a kind of late, and he sent me a photo of his and his wife's photo. Because he said, I'm retired and I went to a national theme park with my wife, and I had a question mark on what am I going to do as a rural doctor when I'm retired? Because we always talk about health education, we always talk about the challenges of rural healthcare workers, but we never think of what's next, what's gonna happen during the retiring time. So the healthcare workforce and also the cycle of rural healthcare is crucial, and we need to talk on this. Thank you.
Yeah. And in this sub-theme, we are going to discuss something regarding the workforce distribution because it's very much skewed. We'll talk about inequities, migration patterns, what are the recruitment strategies, and how we are going to retain them for a longer period of time. These are some of the important areas which will be discussed in these sub-themes, and we'll publish a paper on this. And next is Harini Iyer, who is also one of the author. Can you hear us, Harini?
Yeah, I can hear you. Yeah.
Yeah, a brief opening remark on this.
Well, I just think it's really important and it's really good work that we're doing. And it's also really important to look at upstream and how we are training professionals, and more so in terms of how are we creating systems where students want, or future graduates want to work with community, want to work in rural remote areas. So that is a key interest area of mine in terms of how can, if we have systems that are setting students up that way, if they're in a lot of ways, if we have students who are going into these private for-profit institutions where they are going and paying a lot of, they're taking out loans and they're taking on these financial commitments that they cannot afford, then they spend a large part of their initial career paying those off, and that would be their initial motive. But going forward, how can we either look at subsidizing education or building systems where we are upstream, so that once they immediately go community, how do we incentivize that for them? That's kind of what I would hear.
Thank you. So the issue here is we have recruited the good health workforce, but how to optimize next is how to optimize the health workforce delivery, how to optimize that the resources are well allocated. So this is our next sub themes. And this is one of the important area because for to have an effective and efficient health workforce, service delivery and resource allocation is the important part. And to discuss this, we have got Vikas Goshen, who is very much expert running large hospitals in Nepal. and he'll discuss this topic. Your opening remark, please.
Thank you so much, Pratyush. It is. I think it is going to be a great opportunity to discuss these very important themes with regards to remote and rural areas all over the world. So, in this something, what we are going to discuss is how do we optimize healthcare delivery? What are the strategies for the workforce, and what are the strategies for the resources? So basically, what we are going to do is we will be a lot of authors from Nepal, India, Pakistan, and Cameroon. We also would like to request anyone who would be willing to contribute in this sub team. We will be adding more authors as well. So basically, we'll be reviewing the global best practices, and then also trying to prioritize what all others can learn from these practices. So hopefully we will come up with some of the recommendations which can be helpful to others. So my goal is to team up with all the authors, and then start working on this, and then and share what we found, what we will be finding, and then we will have good recommendations, I guess. Thank you, Pratyush.
Thank you. And next, I'll ask Vasundhara to also add her comments, because this is something which might be of interest to her regarding pathology services and everything.
Okay, thanks, Pratyush. So I would look at it in not just pathology but also biochemistry and microbiology and hematology. So I've been training or lab capacity building in rural areas for the last 20 years, I can say, in India, and had the opportunity to participate in Cambodia and Ethiopia and Panama. And it was just by chance that I got into lab medicine, but I realized that how important it is when we are talking of AMR, and if we can do rational care, if we were able to train some people in the rural areas. Like, I don't know why there is a fear of microscopy, because it is more resource intensive, but then we are thinking of doctors, or it's more skill intensive. But I've been increasingly seeing the irrational use of antibiotics because of the lack of a simple test. And the other thing I'm not able to digest is, why do we think point of care when it comes to rural? Point of care is also used in urban or in cities and towns to give reports. So I wouldn't like to trivialize rural illnesses as something that just need point of care. We are talking of a population that depends on day-to-day earnings, and we really need to shorten the turnaround time for them. And there are complex illnesses actually in the rural areas because of the delay in diagnosis, or the fear of losing a lot of money. So I wouldn't trivialize the need for lab medicine in rural areas. Secondly, also that we could have a hub and spoke model for certain things. And then thirdly, I've seen the quality of lab reports, even from the cities, is pathetic. So it is not that it's really good that we can count on this somewhere else. I think a lot of ramping up has to be done in this field, and it has to be marketed, and it has to be out there that lab medicine is an important pillar for affordable care, for reducing out-of-pocket expenditure, for reducing antimicrobial resistance, and to provide comprehensive care, and to reduce the mortality and morbidity. So it's as important as any other pillar in clinical medicine. Yeah, thank you.
Thank you. And we have Sachin Bavde. Can you hear us? Sachin from Jharkhand is working in very rural areas of Jharkhand. And if he could hear us, we'll take his comments then. So next, I'll also like to bring in Dr. Pavitra Mohan, who runs a hospital in rural parts of Rajasthan. And I would like to know regarding some hurdles in this health workforce, uh, resource allocation, deliveries, and other things. What do you find the hurdles specifically? How do in running a hospital at that much scale? What are the challenges you see in health workforce recruitment, resource allocation?
So thanks, Pratyush. I didn't know I was to speak. Therefore, I was typing in some messages in the chat box as well. So I think there are to me, two kinds of challenges at the moment. Especially, I mean, and I'm much more familiar with India, and therefore it might not be applicable elsewhere. One is, I think, in general, primary healthcare and rural healthcare is not seen, and including family medicine, is not seen as a glamorous kind of an area to work in for young people, and that affects how people are drawn or not drawn to this sector, right? I mean, everybody in India wants to be seen as a cardiologist or a pulmonologist, or a nurses want to become a specialized nurses. So how do we make this a glamorous occupation, something that's really, and it is not only, and I'm not saying this only as a altruistic reason, but also because it is challenging. It requires you to apply yourself fully out there. You know what Bruce says as generalism is so much more demanding than specialized care, and having those management skills, cultural competencies, etc. It is much more fulfilling in many ways, not only from a service point of view. So that's one kind of a challenge that we as a community need to deal with. It has to do with governments, but also with communities like ours to do that. The second challenge, which is especially in areas like India and in other rural remote areas where infrastructure and other environment is pretty difficult to live and work in such in rural areas, is that it's not only the training and availability. As I was typing in India now, increasingly every primary health center in the country has more than one, on an average, more than one doctor and 2 to 3 nurses. So the number gap is decreasing, but the problem is a demotivating work environment and work culture, which does not allow people working in rural areas in primary health centers to deliver optimally. They are demotivated, they are not supported. It's a hierarchical and many times even abusive work culture that exists. And that is what is affecting people, workforce to deliver optimally. So while training and initial training is important and skills are important, how do you create that work culture that makes people perform, and not only perform with joy, and
Yes.
optimally using their skills? So these are the two twin problems that I see going ahead. Production and recruitment is increasingly less of a problem and will become less so in India. We are producing almost 1 million doctors every year, and I don't know how
Yes.
many nurses. So it's the number game is not so important right now. People will
Yeah.
move to rural areas also because they won't have jobs in urban areas. But then would they be optimally productive? Would they lead to improvement in healthcare in those areas? Would they fulfill their own career aspirations? That's a problem.
That's more about efficient utilization of resources and how they are well retained in a very conducive environment, how we give them that environment so that they can be retained for a long period of time. They love to do work there. So that's very important. And the best part of Summit, as I find, is that we are going to have document these things from different sources who are working in rural India, and they experience these things firsthand. So we'll have these things documented, which we are discussing it. So next is Sachin. He works in rural areas and would like to get his comments on these things.
So thank you, Pratyush, for letting me know about this summit. And it would be great to hear from Pavitra and other colleagues, similar colleagues who are on the same path since last so many years. And my journey in rural healthcare began from 2011 as a medical officer in the government setup, and then I moved to the small non-governmental organizations in difficult and rural tribal parts. And what I am seeing during these last 7 years in Jharkhand also, that in this period of time, I realized the importance of the other healthcare workers and the common people from the villages who can be a good source for this healthcare. And it should, I always think, because I am the one doctor from our medical college who opted for this rural posting, but none other than from the hundreds batch, no one willing to do it. And even after 15 years from passing out my undergraduate, still no one is willing to come in these parts of the rural India. And as we become more aware now that it will not be possible to attract these young doctors for rural India, but how we should create that mid-level workers and others who can cater the larger populations. And as earlier speaker mentioned about the use of technology, that also need to be like in this district or about 2 million population where there is no single psychiatrist or mental health services. We when with one of the premier institute like Central Institute of Psychiatry, and through collaborative telepsychiatry consultation, we are providing the telepsychiatric services for these peoples, and all follow up and all this is done by the rural facilitators. So that can be we can do like that.
Thank you. Thank you. And next, I'll invite Angelus Cyrus, who's joining us from United Kingdom, to discuss something regarding the workforce which they see in their areas of work. Can you hear us, Angelus?
Hello, yes, I can hear you. Hi, I'm Dr. Cyrus, Angela Cyrus. I'm from the UK and I'm the European Raw Seeds Ambassador. I apologize because I'm on call, that's why my camera's on and off and I'll be in and out. So the reason I was interested in kind of work, my main focus in that sector is in terms of workforce distribution. I think for me, there's been recent changes in the UK training program in that we are randomly allocated to different areas within the United Kingdom, which increases workforce within rural areas, particularly places like Northern Ireland, Wales and Scotland. So I think that coming, as I'm a recent graduate and I'm quite a young doctor, coming from a recent kind of perspective of the medical system and training, I think it's important for me to understand and kind of contribute what I've seen has helped me in terms of learning about rural healthcare and workforce retention, in terms of seminars, clinicians that practice. So I'm really excited to be a part of this and learn more from my fellow colleagues, and some of you I know and some of you I'm excited to meet. So thanks, guys.
Thank you. Thank you. So next we are moving towards global health, and that's from our local lens on challenges and solutions, because global health is only we discuss from the Western perspective. Here we are going to discuss something from our own perspective, that how LMICs are finding solutions to their own problems and how we can see the global health issues from our own viewpoint, and the understanding the root cause of health disparities and building local capacity and fostering partnerships. And to discuss this, we have multiple authors. Govit from Sri Lanka is there, Jakur from Bangladesh, Hansika from Sri Lanka, Roshni from India, Kinle Bhutin from Bhutan, Amnya El Sharif from Egypt. And we'll start with Govit.
Yeah, once again, yes, as we said, so most of the health model or maybe what are the health delivery system are defined to that maybe not suit to the rural setting, because we have the unique challenge. That we have maybe geographical barriers, limited healthcare access are there. Also, as already we talk about the shortage of skilled health workers. So, and more than that, most of the rural area, maybe the LMICs. So we have the lot of social determinant of the health and lot of issue on that. So the poverty and education, low literacy and education. So and also we have a lot of not related to the health, but the political economic instability is also some of the reason we will have the challenges on the both part in the even the rural or maybe in the LMIC, and some cultural and social barriers also there. These are the main thing I have just summarized to in the brief way. But in the I have planned to have some more in the position paper. So actually, so as we think, so if we talk about this local lens on addressing these health disparities, Actually, first we should know about the understanding the root cause of the health disparities, and then only we have to invest on that. So without haphazardly we do that thing. So we should know that why this disparity is coming. And as we'll already talk about, strengthen the health workforce. That's a very important one. So we are talking about so many years. So, but still we couldn't find a good answer. So that should be do some other in the different way. And this is a very important other ones there. So we always think about the model from the other high income country or maybe some developed things. But anyway, we should have the building local capacity to sustain the solutions. Maybe we can
Right.
find some community health workers involvement, someone like this. So, building local things should be some one of the thing. And more than that, so the community involvement. So because we actually deliver the service to our community, so we can get them to involve that and empower them. So that's one of the thing. And one more thing, so always we are like beginning, so we have some disparity or maybe the lacking. So we should have the strength in our regional and global partnership that should be there. So that's not only for the research or maybe the delivery everywhere like we should do. So normally we talk about much about the 10 to 9 gap in the research, but not only the in other aspect as well. So also we have to ready, like even though rural, so maybe now only developing, maybe as a issue. So we should involve with some technological and health delivery on like e-medicine, telemedicine, mobile things and all. So these are something I just to touch on here to tackle the issues and that. So we will
Thank you.
talk more in coming ways. Thank you.
Thank you, Govit. And in the paper, we'll have lots of space to cover all these important points which Govit has described. And I'll like to bring Dr. Omnia from Egypt. Like, what's happening in Egypt? Like, how the rural healthcare is working there? And how do you see this topic as of global health from your own perspective?
Well, I think over the past years, maybe starting from 2004, or even before that, Egypt started a program of family medicine within the Ministry of Health through the Egyptian Fellowship. We have always been facing the challenge of a brain drain of family physicians, mainly traveling to the Gulf areas. Although we're not producing or graduating a big number of graduates in family medicine, but still this number is most of them they just travel to the Gulf areas. And after traveling to the Gulf areas, a few of them just travel to Western areas because we had this accreditation program, and we still have it, the accreditation program of the Egyptian Fellowship with the Royal College of General Practitioners. So they are trained on having international exams. They keep on making continuous professional development when they travel to Gulf areas. So they start joining Western countries. And so there is always a challenge in the rural areas. There is always this, and also there are different systems. For example, you have the Ministry of Health, which has a lot of very successful programs at the level of the primary healthcare. This leads to some kind of fragmentation in the health delivery of family practice. We have an established program for health insurance. Now there are things that family physicians encounter in their clinical practice at the level of the centers, which are covered by the health insurance system, and some other services like primary healthcare services that are not provided in those centers. So the concept and the model itself is a challenge. How can you retain your physicians? How can you ensure that they are providing comprehensive and longitudinal care in related to the family medicine model? How can you retain the physicians? And one of the other challenges also that arose is that sometimes after they finish family practice, they keep on they keep on trying to take extra certificates or qualifications in another related field. So this is currently what I see in the situation, and I think this should be addressed in this paper.
Thank you. Thank you. And next, I'd like to invite Jakur Rahman from Bangladesh. I'd like to ask him to discuss something what he sees in Bangladesh and what his viewpoint on global health from their perspective. Jakur?
Thanks, Pratyush.
Yes.
Some problem are global problem like global health, and some problem are in different context in urban and rural, in LMIC and developed and developing countries. So we need some local solution for sustainable development of healthcare. So many things we should address in South Asian country like Bangladesh. Basic thing is we need to educate or awareness people to healthcare delivery, that is evidence-based healthcare in especially in rural area. We need to train the doctor for rural areas, and we need to policymaker to address these things in right way, because different problem is related with the policymakers. So many challenges we have, and we need to our own policy for the solution in region, in country, and ultimately it will impact on global health. So many author we have already. If
Thank you.
some more are interested, they may join with us.
Yeah, sure. And I have shared the Google WhatsApp group for the summit. If anyone is not in the group, they can join the group where we'll discuss much more in detail these things. And next is from India, Dr. Roshni Jain Ganguly, who will be discussing
Thanks.
things from her perspective. What do she says? She sees global health all about from our own perspective, LMIC's perspective.
Right. Thank you, Pratyush. What I feel is rural health, basically it embodies the intersection of, global challenges and the local realities. So we've discussed about limited access to healthcare infrastructure, not having trained professionals, rural communities often face these hurdles. But yet, I feel that rural health has, it also holds the key to innovations. It holds the key to community-driven solutions, especially with digital health these days. I think to establish an equitable and reach out to the underprivileged, to the very, very remote rural areas can really reshape the global health paradigms. And by integrating these culturally sensitive care, strengthening the primary healthcare systems, and definitely leveraging the local knowledge, I feel that we can address these challenges and create an impactful, sustainable system. So we have to use the power of rural resilience to drive the global health forward. So thank you for that.
Thank you. And Kinley, Bhuti, can you hear us?
Yes, thank you.
Yeah.
I think from Bhutan's perspective, as Bhutan is a very small yet geographically very difficult country where the rural health plays a very pivotal role in its people's health. However, we do have lots of challenges as similar to any other countries in the region. We have healthcare resources, we have human resources. We also face lots of issues resulting from the brain drain, lots of our healthcare professionals going to the western part of the world. And because of that, our people, we face lots of challenges in having, already we are a small population country, but even though we are small, and even if one doctor moves away from one district which caters to around 20,000 people, it really hampers the healthcare of that community or that district. So I think from the global perspective, no matter how modern or how advanced the technologies are, if we are not able to improve the grassroots levels healthcare, the primary healthcare rights for our people, I think it will crumble down. So it's very necessary to have the rural health improved, I must say. Thank you.
Thank you. And next, we move on to our fourth sub-theme, that is regarding the global perspective on rural health, because there's various models of rural health which has worked across different contexts. We have got Australian models, Royal Flying Doctor Services. We have seen it's worked brilliantly in Australia, but that may not be applicable to other parts of the world. because of financial constraints and these things. But to discuss these things, I'll invite Elikana, who's from Uganda. Can you hear us? Elikana Duhara? Hello?
Yes, I can hear you. Hello.
Yeah. Please tell regarding your perspective from Uganda.
Okay, so thank you very much for hosting this session and for bringing the different stakeholders on board. I am impressed by what different countries are doing in terms of global healthcare. So, in perspective, Ugandan perspective, looking at our unique challenges as Uganda, I just wanted to cite the different observations I've made, and as far as healthcare delivery programs are concerned in Uganda. So earlier this year, I embarked on a journey to conduct medical camps, in the different parts of Uganda. And last month, I was in Karamoja. So Karamoja is in the northern Uganda, in the border of Sudan and Kenya, and then Ethiopia. So while I was there, I spent a week. I had gone with a team of doctors in different professionals, lab people, nurses. So we were there to see firsthand, to assist the doctors there in seeing the patients or the clients that have different health problems. So what I learned is that in this community, most of their concerns are really diseases that are preventable. So we still struggle with preventable diseases that are a result of poor hygiene, inefficient water access being a biggest driving factor to most of the diseases we see there. And looking at the programs that work there, both facilitated by the Ministry of Health and also those facilitated by development partners like the government of Italy, most of these diseases are focusing on treatment. They are not looking at the prevention aspect. Yet the biggest problem, the biggest barriers are actually access to the prevention kind of a setting. If we provide clean water so that people are able to wash, to bathe, and to drink clean water, then we would have reduced a number of diseases that are actually preventable and are the ones that are leading causes of problems. So I think in this context, we will be able to bring on board some of the challenges we have witnessed and some of the successes. On the other side of the success stories, I have seen the Uganda Village Project. So Uganda Village Project is a healthcare program that is facilitated by Karolinska, Sweden in Uganda. So this program looks at giving clean water and other associated health services to the people in Jinja. Jinja is also in the eastern part of Uganda. So in this program, there have been a number of successful outcomes that are documented in the community. And when I compare this program and the challenges of people in Karamoja, I see that there is a step the Uganda Village Project has taken, which I think can be scaled to Ugandan setting in the Karamoja region. Then in 2020, I was in Rwanda. Rwanda is also our neighbor here in Uganda. So Rwanda has a community health workforce strategy, a program where community health workers are empowered. They are trained by general practitioners, and then they go to the community and try to do some of the work in the form of, let's say, task shifting that the doctors can be able to do, but at the lower level. So because of that, Rwanda has been successful in dealing with some of the non-communicable diseases and communicable diseases at once. That is one of the most successful programs that I think we can benchmark on. I want to stop here and I look forward to contributing.
Yeah, I think in the paper we can discuss more of these things in detail, because preventive, promotive, and palliative care is something which we forgot most of the times, and that's very important apart from the curative services. Next, I'd like to invite someone from Nigeria, who is Osama Anita. Can you hear us? Osama Anita?
Hello?
Hello? Yeah.
Can you hear me?
Yeah, we can hear you.
Okay. Hello, everyone. My name is Osama Anita. I'm from Nigeria. I currently stay in Wales. Speaking from the context of Nigeria, it's basically similar to what last week I just spoke about some minutes ago. Most of the issues we are facing, especially in rural areas, are mostly preventable diseases that have still not yet been handled. So most of the resources and everything is geared towards tackling preventable diseases and mostly caused by poor hygiene and the greatest factor, which is the finances and low budgeting of the government towards rural areas. So that's hello?
Yeah.
Hello?
Okay. Yeah, we can hear you. Okay. Okay, thank you. So we'll move on to our next speaker, who's Dr. Manish Pravakar from India. And I'll request him to just give a brief rural health model from India. What's the model which we see? Because he's from the community medicine background, and he can just elaborate something on the rural health model which we see in India.
Hi. Basically, okay, we'll discuss on that the rural health model. But today I'm focusing basically. I'm highlighting the critical issues that affect millions of people in low LMCs. That includes India also. So in LMCs, the rural areas are often characterized by the limited access, like healthcare services, access to the healthcare services. That is a big problem. Shortage of healthcare professionals, and in India also the inadequate infrastructure. This result the poor health outcome, and however, and there are solutions that can be implemented in India. There is a lots of every month. So I am from Sevagram, so most of the part are using Sevagram model. Basically the only one single rural medical college, and the first medical college that is in India. So there are solutions like task shifting, task sharing that can help to address the healthcare workforce shortage. The digital health technologies such as telemedicine and the mobile health services. Nowadays, telemedicine is everywhere. In India, the initiatives like the National Rural Health Missions and the Ayushman Bharat Yojana have shown promises the strengthening of the rural health infrastructure and services. But we need to do, but we must prioritize the rural healthcare to invest the infrastructure and the workforce development, and also the leverage of the technologies.
Okay. And thank you. Now I'd like to invite Anna Stavdal. Can you hear us? Something you can talk about Norway healthcare? Dr. Anna?
Yes, I'm here. Wait a minute. I'm just starting my video. Yeah, that's a huge question. I guess Norway is privileged in the aspects of the issues you are discussing here. Also, when it comes to rural doctors or doctors in rural areas, I used to say that Norway is rural in principle. Of course, we have something we call cities, but compared to the rest of the world and bigger countries, they are very small. So the majority of the population lives outside the big cities. And we have, when it comes to training, recruitment, and retention, of course, there are issues. We have challenges. We have the same trends we observe in all countries with centralization, etc. We have a uniform training for all GPs in Norway, whether we are to work in the cities or in the rural areas. And I think also everything is relative. I mean, but the distance from small communities to hospitals, for example, is much shorter in Norway, even if we think the distances are long, if you get me, compared to other countries. So I think we are so far we're privileged, even if we observe the same trends as in other countries. That said, what I say, so I'm cautious not to neither brag about the very positive situation, because there are challenges, but then again not complain, because I see that the challenges are so much bigger in other countries. So far we're good, and I must say, in this, when I'm listening to the issues raised here and the reports from different countries, it makes me humble, because the challenges are huge. I think, and those of you who know me and have known me for many years, and also through my term as president, I believe in unity and also to build bridges between GPs working in different contexts, and that goes for, I mean, in the international axis, but also inside the countries. So if Norway to some part is a success story, I think that is one of the factors that makes us success, and we're so few also. So we need to stick together. Short of 6 million altogether, which is a city in many of the countries you guys are from. That's the whole country.
Yeah.
Thank you.
Thank you. Thanks a lot. And next, will take some viewpoints from Colombia by Mayra Alessandra. Can you hear us?
Yeah, I'm here. I'm so sorry, but I didn't listen to the last thing. Could you repeat it?
Yeah, we're talking about the rural health models and what are the lessons for LMICs. So can you please tell us something about the rural models which you see in Colombia?
Well, as I was saying in the chat, unfortunately, I mean, in Colombia we have a health system, but it's based in the hospitals and maybe some primary centers. But I think it's really important to have differential view of the rural areas, because of course these areas have special needs and the financial issues are really matter. So in my area, mainly it's a compromise of the university where I work, and we have community project, but unfortunately it's really matter highlight the responsibility of the government and in these issues. Yeah, I mean it's not enough the local projects, but in this moment in Colombia we have aiming a health system that could be much more universal and have a differential view of these rural areas. And also, I think I would like to remark the really importance of the community participation. I mean the participation of people of all. Yeah. That's the way as we work. Have always the view that we need no above people, with people. Yeah, and well, that's what I want to say.
Okay, Thank you. So we'll take final two comments from Australia because we hear lots about that. And we'll take from Bruce Chater and then Marjorie Cross. Your brief comments at what has worked in Australia and what hasn't worked in Australia.
Thanks, Pratyush. And I was just tapping in the chat just to say that we are very privileged, as Anna says, in lots of ways, but we haven't sorted all the problems really. One of the things that I think is key in Australia has been the rural generalist program, is actually specific training for rural, and making sure that the skills are properly tailored for rural areas, and that the doctors can then be both motivated and competent to do the things that communities need. I think the other lesson that we've learned is just making sure that there's multidisciplinary teams, and that will vary according to the resources that there are around. And actually, as Pavitra said just a few moments ago, make it a fulfilling career, a motivating career, something that really young doctors aspire to. And young doctors are now showing more interest in rural generalist medicine. So that's probably something from us, but in a very humble way, I think, given the issues that there are all around the world. Thank you.
I think we need many rural health exemplars, like the models and the superstars like you and Pavitra, who can inspire many younger generations. And basically, Rural Seeds is one of the important aspect of that, who has inspired lots of doctors to work towards rural areas. And they are themselves inspiring another ambassadors. Late there in Australia. Okay, so we move next. There's next one. There's hand. Dora Bernal. Yeah, we'd like to hear it from you. Dora?
Hi.
Yeah.
Hi, thank you. I'm here. Thank you. I want to say this is we have models that privilege urban areas, although rural laws are contemplated in their laws. That is very that is why I think that it's very important to invite world and local authorities to these events so they can understand the dimension that we in the rural world can afford, can bring to the health system in the totality.
Okay. Thank you. Thank you. And next we move out to our fifth, the most important, which was recently a lot in news regarding climate change. We had recently have our COP24 meetings, which is lots in news. And this is also the important topic of our summit. And that is regarding climate change, urbanization, and future of rural health, how digital health and e-health is coming to play, and how this urbanization of rural areas, how it's going to impact our rural areas, because urbanization has got its own consequences. Rural areas are shrinking geographically, and how it's going to impact, how the climate change is going to impact. And we have got one of the most Wonka Rural Secretary from South Asia, Sankha, who is going to lead on this topic. And he's also the chair of relevant working party and environment. Please tell. Sankha?
Thank you. Thank you, Pratyush. Yeah, so our topic is climate change, urbanization, and future of rural health. Probably we can focus on addressing challenges and opportunities. Yes, as you told, of course, I'm not the chair yet, but I'm the chair-elect of Wonka Working Party on Planetary Health, and also my background, because my postgraduate studies around public health, focusing on planetary health in the London School of Hygiene and Tropical Medicine. That's why I thought that I would contribute to this topic. So when you talk about climate change, we all know that main contributory factor is global warming. And one main reason is emission of greenhouse gases. And we know that rural areas and lower and middle income countries, LMICs, they have the least contribution to greenhouse gases. But unfortunately, we also know that rural areas are the most vulnerable to climate-related health risks and limited healthcare access. And this is because resources are concentrated in urban settings. As you all reminded before about the health inequities. So when we take urbanization, the impacts of the climate change and urbanization on rural health, they are interconnected, right? And this also creates complex challenges, not only, I mean, related to healthcare, but also when you take the social and environmental challenges as well. So this, I think, demands a specific approach to the rural, especially when you talk about rural health. And so when we are talking about mitigating and adapting to climate change, we need an integrated approach, as Pratyush told, and also probably innovative health models like related to telemedicine, etc., and also probably policy change, policy approach, especially new policies related to that. So these are the things we are probably going to address in our paper. And probably we can have more people, Pratyush. I would like to invite, because there are about, I saw about 30 people here. So I would like to invite you all colleagues. If you have more colleagues who have some expertise or interest in this area, please feel free to invite them to contribute to this paper. And Pratyush, I would also like to tell something interesting. We initiated to green the Wonka South Asia conference in Bangalore by following Wonka Equitable and Sustainable Planetary Health Event Policy, which was approved actually last year when Anna was the president, which was prepared by the Wonka Working Party on Planetary Health. So Jyotika Gupta, who is not here today, but she's contributing, and she's joining me to lead this initiative from the Wonka South Asia Conference host organizing committee. So I think we can make. I mean, this also has something to do with the climate change. So we thought we have to do whatever we can do from our side. So I just want to mention that as well. So finally, again, Pratyush, let's try to get some more people into the paper. And yeah, thanks very much.
Sure. Yeah, I also remember Karen Flegg in her presidential speech. She went all out on making it green. That was her presidential main focus.
Exactly. Yes.
Yeah. So thank you, Sankha, for your comments, and I'll bring Nishant Menon for his comments.
Yeah, I mean, I'm really happy to contribute to this because I fell instantly in love with the topic because of some personal connections and because of some personal experiences, especially during the COVID era. I got inspired by some of our previous Wonka members also to take up farming for sustainability, and so I think I can also contribute not just as a family physician, as an emergency physician, but also as a farmer, as to how climate, health, urbanization, and also all these things has got an important interplay that affects rural health. So really looking forward to certain things, but also another important aspect is certain infections certain climatic emergencies like submersion injuries during rains, heat stroke, and all those heat emergencies. These are things which we see all these the evolving patterns with regards to newer health problems here in South Asia. So I think those can also be contributed from my side.
Okay, thank you. Thank you. And now I'll bring Izaz Khan from Pakistan, who will be talking regarding climate change.
Yeah, thank you, Pratyush. I have written some text in the chat box just to give the background of climate change and how it is how both the climate change and the urbanization, they are affecting the rural health. So and I see that the role of primary health care physician is very much important because they have to stay informed. They have to conduct climate sensitive consultations. They have to foster community engagements, and they have to advocate for policy change. And these things are very much important because you see, a few days ago, I read a paper written by someone from Pakistan, where with a few of British and American authors, and they actually address a very important issue: how to prescribe when you have very hot weathers or very cold weathers. So the prescriptions are very much important. We prescribe as we are being taught in the guidelines, but sometimes the climate change, the hot weather or the extreme cold weather, they also have their own influences on how those prescriptions are done. And one important thing is this, that the that's very important thing is this, that the primary health care physician, they should also be looking at how to design and implement interventions that are tailored to the specific needs of the context of rural and urban communities in South Asia. That's a unique kind of challenge that they face. That's also told by two of our worthy speakers just now. So what is required also is to develop and implement climate resilient health programs in these rural areas, which are being engulfed by the rapid urbanization and the rural areas becoming semi-urban areas and then becoming the urban areas. And very, like in Pakistan, if I talk about Pakistan, we are losing a lot of agricultural land, but we are having a mushroom kind of growth of societies. And that urbanization is not only engulfing and destroying the very precious agricultural land, but also the very precious rural community and the setup and the environment that the people used to enjoy. That is also is getting bygone. And with this coming challenges and the future, how we look at the disease patterns which is going to spread, and the ratio of communicable and non-communicable disease that is going to be very rapidly coupled with the issues of malnutrition. So the young health professionals who are going to work in the rural areas, I think they must understand what challenges they are going to get, and they must be very much oriented towards how to use their knowledge and convert and use it as a part of the climate sensitive consultations when they consult patients, I mean, they consult the communities, and when they go into the communities, they should be very much cognizant of the climate sensitive questions when they do the consultations. Thank you.
Thank you. So, like, that's all the 5 sub themes from us, and now it's an open session for everyone. Those who would like to add their comments, they can just raise their hands, and I'd like to invite them. So first, I'd like to welcome Prem Adhish Likhi, and if you can hear us, can you speak something regarding the area of interest? Dr. Prem? Okay, so like these are some of the 5 sessions, 5 sub-themes, which we will deliberate and will publish a complete paper, position paper on these 5 areas, 5 sub-themes. But in case if we have got much more newer topics, newer themes, newer interests, we can add another paper also to this publications. And all these papers will be published during the summit. And during the summit, we'll have 3 sessions. One session will have a consultation meet, which will be done by Dr. Pavitra Mohan. And next, in the morning sessions, we will do we'll introduce a new team of Versa, which is Wonka Rural South Asia. We'll introduce the new chair and the executive members of Wonka Rural South Asia, the new working group. And we also introduce the new working group of AFPI Rural, which is the Academy of Family Physicians of India, that the work we'll do in the morning sessions. And the afternoon evening sessions will conduct the summit part. And depending upon the interest, either we can do panel discussions or workshops on these 5 sub-themes. And we'll also invite another from people that their viewpoints. And based on their feedbacks, we will organize the whole program. So it will be much more democratic fashion. We'll organize the summit because it's the first time we're doing the summit. And obviously next year, like after the summit, we also have got our World Rural Health Conference in New Zealand. So we'll be promoting that conference also during the summit. I'm just giving you this information. And if any one of you would like to add their comments, they are welcome to join us and speak. No. So finally, I'd like to bring a concluding part, and I'd like to invite Dr. Roshni to add her final comments and invite everyone to join our Wonka SAR conference. And followed by, we'll have Dr. Bruce, Chair of Rural Wonka. Yeah.
Thank you, Pratyush, and it is indeed my pleasure and honor to invite each one of you to Bengaluru to the Wonka South Asia Region Conference. And what a lovely meeting today, Pratyush. Thank you for that. And we've got people across the world, and it is actually it's indeed wonderful to see the active participation and so many important points highlighted and discussed. And I'm sure we're going to take it forward to the Global Rural Health Summit. So once again, I welcome each one of you, and we would be very happy to welcome you in Bangalore. Thank you very much.
Thank you. And next from Sankar, he changed the background. So in the official role as secretary.
Pratyush, just to ask something before calling it a day. What is the next step? I mean, would you advise us on the group, or could you just summarize us? Because
Yes,
I was just
yes.
also, I have already thought of starting with because I don't know how you are planning, so you can lead us so we can go to the next step with that.
It's a very democratic fashion. It's nothing something that what I'll dictate and you'll follow. It's not like that. It's something like all the authors of the group, they will decide what they want to do, because I can just give you guidelines. Next, I'll share guidelines on the structure of the position paper. You can choose which topic you want to write, and you can invite many people, expertise, those who have expertise in their field, to join your author groups. And based on your contribution, your name will be published in the journal. And you have to decide that when you're going to host the next webinar, we'll organize this. And now we'll have another set of 5 webinars on each sub-themes where we'll discuss it in detail. And so all the authors, they can just discuss among themselves, and we will coordinate with you all and we'll decide the dates. And obviously, every 3 to 4 weeks, we'll have another webinar on each topics. And that will be very interesting, because that will bring a viewpoint from not only the authors who are writing the paper, but also from different people with different backgrounds. They will be also joining the webinars, and they'll adding their own thoughts, comments on this. So that will enrich our paper. And you will decide whether do you want to do a workshop, or you want to do a panel discussion, or just symposium, how you want to do during the summit, how you want to do. And we will accordingly, we'll frame the whole summit, because this is the first time we're going to do. And these finally will, after the summit, will come to know that what works and what not. And accordingly, we will hopefully, after New Zealand conference, we can organize another summit with much more better feedbacks and we'll incorporate it during those times. So that's all from how we are going to do it. But we'll take your feedbacks, and based on that only we'll plan the summit. Okay.
Lovely. Thanks very much.
Okay. And final comments from our Rural Wonka chair, Bruce.
Thanks, Pratyush, and it's really just terrific to see such a group of people here tonight. We look forward to seeing you in Bangalore and also obviously in New Zealand the year after for the Rural Wonka conference there. Having this Rural Summit is an initiative of Pratyush, and I'm very proud of him and what he's done to get this group together and to get this summit together. We look forward to him taking over from me as chair at the International Wonka Conference in Lisbon later next year. And I look forward very much to the discussion, look forward to joining you in Bangalore. So thank you very much, Pratyush, and a bit of work to do between now and then, but I think it'll be terrific. Thank you.
Thank you. Anna, would like to say something before we...
Just to say thank you. Looking forward to Bengaluru and to listen.
Thank you. And it was very amazing webinar, and I'd like to thank you all for making it. I really enjoyed listening to all your comments and feedbacks. And obviously, we'll meet very soon in 3 to 4 weeks' time for another set of webinars. And till then, and my apologies because we just planned it for 1 hour, but discussion was so lively that we extended it, become 1 hour and 40 minutes approximately. So apologies for that, and we'll see you next time. Till then, take care. Bye-bye. Thank you.
Goodbye. Bye-bye.
Bye. Goodbye. Good night.
Bye-bye. Thank you, everyone.
Thank you.
Okay, bye-bye.